in our life surgeries that you can do for a herniated disc. So, those of you who do not know me, my name is Swati. I'm a physiotherapist or a physical therapist, and expert. I'm an expert with spine and posture. So, so I am doing these series on the disc issues because I just want to bring about awareness about a topic that is not very commonly, I mean, it is commonly talked about, but it is just something that people need to know more about and make more conscious decisions when it comes to their healthcare. So if you're watching me on the live, please comment or give me a like, or just let me know that you're here so I know you're on the live with me. If you're watching a replay, just comment #replay so I know you've been here. Okay, so moving on. So, what are the surgeries that you can do for a herniated disc? Before we look into the surgeries itself, why would anybody go in for a surgery? So, if you have tried all conservative treatments and you haven't had any relief, say you've done your physical therapy, your acupressure, or you've done your core strengthening stretches, all your exercises for 2 to 3 months and you still haven't had any relief, you have that constant pressure on your nerve roots and it is affecting your quality of life, it is time to talk to your doctor or your neurosurgeon regarding surgery. Right. So, for example, if you have something like cauda equina, where your bladder and bowel functions are getting affected, this would create a weakness in the legs as well, and you can have partial to permanent paralysis. So, if you have such severe complications from your disc issues, then I think it is a good time to look into surgeries. So, your doctor can suggest either a discectomy. So, basically, what that is, that they take out a part of your disc, which is the problematic area. They do not take out the whole disc. So, that's why the micro discectomy. So, that's one. Another one is when they remove the disc, so a disc replacement. So the whole disc is taken out. But what happens with disc replacements is, especially in the younger people, as they grow and age, the segments above and below, so we're talking vertebral segments above and below the surgical area where they have had a replacement, can get hypermobile. So basically, your spine has got vertebrae stacked on top of each other with disc in between. So if the any one part of your spine is not moving well, I mean, irrespective of surgery, this is in general as well, if it's not moving well, the rest of the spine will try and compensate for the movement. So the segments above and below the affected ones will try to be more mobile to overcome the lack of mobility in that affected segment. So what happens here is, if you have a disc replacement, the segments above and below tend to be more mobile. So you tend to have more chances of disc prolapse in those two segments, above and below. So it's not very commonly done. Lamina is a part of your vertebra. So basically, they remove a part of the vertebra. So your disc has more sort of space in within that vertebral segment. So when they remove a part of the vertebra, the disc can actually be relieved of the pressure that is being exerted from the surrounding bone. So you have got microdiscectomy, laminectomy, and disc replacements. These are the common surgeries. Of course, there are many more. So if your doctor suggests that go in for a surgery, discuss with them what sort of a surgery is it, what are the complications, what is the recovery time. Be an active partner in your rehabilitation, in your medical treatment. So ask questions. It's your treatment. Don't be shy to ask questions, right? And see, any surgery, any procedure, even if it's like a local anesthesia, right? Anything where you are interrupting the processes of the body will have some or the other complication. But then if you have a disc problem which is affecting your quality of life, you probably do want to address it. And then if surgery is the solution, then so be it, right? However, having said that, there is no 100% guarantees that your surgery will take care of the problem completely. So yes, there is a long way after the surgery as well, where you do have to undergo physical therapy, where you still have to do your core exercises, your stretching, strengthening, your if you need balance exercises, etc. So yes, talk to your doctor and talk to your physical therapist and ask them the pros and cons of the surgery. How long can you take it? Like take long, how long, sorry, how much more longer you can take, or put off the surgery, or is it urgent? Talk to your doctor. They'll be the ones who will advise you the best about this. And if you have any questions that I can answer for you, feel free to pop them in and message me or ask me on the social media platforms, and I'll be happy to help you. I also have a Facebook group. It is free for anyone to join, where we discuss similar topics, and I would love to have you join there. I'll leave a link in the description of the video. If you are interested, please feel free to join it, and I'll be happy to help you there as well. Alrighty, I hope that was helpful. I'll catch you guys later.